All right. Good morning, everyone. We're going to get started. Thank you for being here. We're so excited that you're here today with us for our annual New York State Parenting Education Partnership Training Institute. As I said, this is annual. We have it every year, and me and a small group of folks get together regularly and plan this for the whole year. So we're really happy to be actually holding it today virtually. So it's called Knowledge to Action, Implementing the Strengthening Families Framework in Your Practice. Next slide, please. And another formal welcome. My name is Kristen Weller, and I am the co-chair of the New York State Parenting Education Partnership. Throughout today's discussion, you'll probably hear me or other folks saying Nicepep. So we are Nicepep for short. In addition to my duties as a co-chair for Nicepep, I am also the New York State Birth Through 5 Project Manager at the New York State Council on Children and Families. Next slide, please. I would be remiss if I didn't acknowledge some of the folks that helped to put this day together, as well as our New York State Parenting Education Partnership conveners. Our conveners, the organizations that help to guide us as we move ahead to support parenting education in New York State, are Prevent Child Abuse New York, and the Office of Children and Family Services, the New York State Education Department, the New York State Council on Children and Families, the New York State Office of Mental Health, and the ad hoc committee who have worked together over the last year to make this day happen are Susan Perkins, Kate Preventure. Kate is from the Office of Mental Health. Susan Perkins actually recently retired, I think actually 2 years ago, from the New York State Council on Children and Families. Kate Preventure, like I said, from OMH. Then we have Tamaya Memoli and DJ Gilmore, both of which are at Prevent Child Abuse New York. So thank you all for working together to make today happen. Next slide, please. So before I talk a little bit about Nicepep, just want to provide everybody today's agenda. This is the overview of the day. I will be talking for about a half an hour, just talking about the New York State Parenting Education Partnership and what we do. Then we will pass it on to Cailin O'Connor, who's our keynote. We'll have a break for lunch for half an hour, and then we will come back, excuse me, in the afternoon, and you'll have a welcome from Tim Hathaway, who co-chairs the New York State Parenting Education Partnership with me. And then we have some afternoon breakout discussions with small group facilitators, and then we will do our closing with Cailin O'Connor. Next slide, please. So today, we have a couple of poll questions. And we thought that the poll questions would help for a few reasons. One is that we thought it might help our keynote speaker as she talks today about the strengthening protective factors and some big picture thinking around the protective factors, if she knew a little bit more about what you all think about these protective factors, which ones resonate with you the most. And then we thought it would also help the small group facilitators informing their discussions. So this first poll question, which protective factor resonates with you the most? And it's okay if you don't know about them all, but if you look at these, which one resonates with you the most, even if you know nothing about these protective factors? Parental resilience, social connections, concrete supports, knowledge of parenting and child development, or social and emotional competence of children.
So,
Maya, you just let me know. Yes.
So because all of us from Prevent Child Abuse New York are logged in on the same account, our polls are inactive. So if folks could type it in the chat, that would be very helpful.
Sure.
Thanks.
No problem. That's an okay way to do it too. We have parental resilience, social connections, concrete support, social connections, parental concrete supports, parental resilience, concrete supports, social connections, parental resilience. We've got a lot there, Maya, don't we? I feel like I see a lot of concrete supports, but I keep seeing parental resilience pop up. Concrete supports, concrete supports. Yeah, I know. Wow, those concrete supports were so important over the past couple of years now from COVID, you know, parents needing diapers, laundry detergent, you know, just those basic needs that people were really struggling with having. So that's an important one too. So thank you. That's really, really helpful. And what I'm going to do is I'm going to try to kind of do a quick count of these for later in the day, and I'll tell you what the tally is.
I can do that for you, Kristen.
Oh, thanks, Tamaya.
Yepper.
So the next poll. So we put this poll here again on purpose, and it's not going to be a poll. It sounds like it's going to be something that you all put into the chat. And we put this here because while I'm hearing so much about returning to normal, let's get back into the swing of things, returning to work, our children returning to school, we know that there's still a pandemic out there, and we know that a lot of us are still managing, sort of reemerging, and still finding our bearings. And so this poll is a check-in, and this is optional. Please don't feel like you have to put this into the chat if you don't want to. It's mostly an invitation to attend to yourself, to notice how you're feeling, to be patient with yourself if you aren't feeling as great as you'd like to feel today, and just an invitation to take care of yourself throughout the day. And, you know, checking in with yourself, seeing how you're feeling now. Do you feel like you're fluctuating? You know, maybe you want to get to surviving, maybe move on to gliding as the day goes on. So I encourage you all to check in with yourself throughout the day, take the breaks that you need to, and pull away when necessary. Close your eyes if you need to, take a break for 30 seconds, whatever is needed. So if you're comfortable, please indicate in the chat, you know, how you're feeling today. If not, you don't have to. Just check in with yourself. That's what. Yeah. Oh, some thriving in there. That's nice to see. Gliding, great. Yep. Some fluctuating. I'm with you. I'm with you with the fluctuating. Surviving. Oh. I'm gliding along. That's great, Wendy. Fluctuation. Yep. Great. Waiting. Thank you. Thank you, everyone, for your honesty and your comfort in doing that, because you didn't have to. So we're all moving from fluctuating to thriving. I'm glad that no one is struggling and no one is sinking. But if you are, like I said, this is an invitation to be patient with yourself and pull away when needed. So thank you. We will move along. So this next slide, self-care isn't selfish. Just remember that. Something I have to remember quite regularly. Self-care isn't selfish. Okay, next slide, please. So pivoting into Nicepep, into the day. Nicepep is a partnership of parenting educators and parents in public and private New York agencies. Those agencies I talked about in the beginning: Prevent Child Abuse, the Office of Mental Health, the Office for Children and Family Services, the Council on Children and Families, and the State Education Department. Those are our conveners. Next slide, please. we have a vision and we have a mission. And it's that all children grow up in nurturing families. And these are our components. These are the different components of what we do. It's important that we enhance parenting skills, that we enhance knowledge and behavior by developing a strong network in New York State that provides and improves high-quality parenting education. Parenting education looks like many things. There's parenting educators that are certified parenting educators, and I'll talk about that in a bit. But there's also people that are parenting educators that might be a Head Start teacher or a child care provider or an early intervention specialist or a home visitor. So parenting education comes in many forms. And so like I said, these are components, and I'm going to talk a little bit about these different components. There's a professional development piece of what we do. There's a community coalitions piece of what we do, parent leadership and parent partnerships piece, as well as some other projects that I'll talk about. Next slide, please. So professional development. So you'll see that there are 4 components, 4 buckets of professional development. We're just taking some time here to enjoy that slide there by Walt Disney. Our greatest natural resource is the minds of our children. Isn't that the truth? So professional development falls into these 4 buckets. And I'm going to talk about each of these buckets. And the first is the New York State Parenting Education Partnership Parenting Educator Credential. Thank you, Tamaya. Next slide. Our slides have a mind of their own today. They're just doing their thing. That's okay. We got this. So the Parenting Educator Credential, what is this? I talked about this a little bit already. So it's a professional recognition system that assesses and acknowledges professional parenting educators' education, training, skills, and experience. And the application process involves developing a portfolio to document your knowledge, your skills, your competencies for the work in the field of parenting education. And the Parenting Education Credential is a New York State Parenting Education Partnership Credential. It was developed by Nicepep, and so we have a whole team. We have a credential committee that works closely with folks that are interested in this application process. And you can go to our website and click on the credential button and see what you need to do in order to get your parenting education credential. The application deadline is January 31st. If you have any questions, I'm going to put my email into the chat. And then you'll also see at the end here, we have other emails for other folks that are part of Nicepep. You can reach out to any of us and we will help you. Next slide, please. So this next slide talks about the Parenting Educator Credential competencies. So like other credential programs, degree programs, licensing programs, there's a list of competencies that folks need to meet. And so for this specific training and all of the trainings that we have for Nicepep, we share with our parenting educators the different competency areas that each training fulfills. So we've got, for today's training, these are the different competency areas that it fulfills. However, this list is not all-inclusive. This doesn't include all of the competency areas of the educator credential. But like I said, if you go online, you can find a list of all of them and the specific trainings that you can attend to meet the different competency areas. Next slide, please. And this is the next part of professional development. We have our Strong Roots trainings. So first I started with the Credential, and now I'm going into Strong Roots. So Strong Roots are developed by the different community coalitions that we work with. You can go to the next slide here, and it shows you some of the different posters that our partners have developed related to the Strong Roots trainings that they were doing in their community. So as you can see, these are a couple of years old, but there was Strong Roots training in I think the Southern Tier. There was Strong Roots training. Yeah, it looks like Tompkins County, yep, in the Southern Tier there. I'm not quite sure where, I think it's Hormel or Hormel, New York. I can't read it really very well. A Pro Action, I think that's either Central or Southern Tier as well. But these are just a couple examples of the Strong Roots trainings that are held throughout the year, led by the community coalitions. I'll talk about those in a second. Next slide, please, to the webinar series. So the New York State Parenting Education Partnership webinar series, we have webinars throughout the entire year. And on the next slide, you'll see some of the examples of those. So we had a New York State Parenting Education Credential webinar recently, talked about what it is and who should get it and why. We had one about incorporating storytelling into your work. We had webinars about community cafe orientation. And we do have some, I think we have a webinar coming up in December. It hasn't yet been confirmed, all about adult learning theory. And so stay tuned. If you sign up for our Nicepep e-news, you'll get notifications of the different webinars that we have, and they're free. They're free, so it's always a good thing when something is no cost. Next slide, please. I'm going to talk a little bit about those community coalitions. So earlier I was saying how our community coalitions put together these Strong Roots trainings, but that's not all that they do. So if you go to the next slide, you're going to see all of the community coalitions that we've worked with over the past several years. And so we've provided grants to all of these local communities since 2018. We usually have 2 to 4 community coalitions in the cohorts. And this year, Cohort 4, we have, let's see, folks from Allegheny, Cattaraugus, Steuben counties. We have Onondaga County and Nassau County. And let's see, those include Connecting Communities is one organization. The Early Childhood Alliance is another organization in Onondaga. And yes, Community Counseling Centers Partnering in Action, Change for Tomorrow. That's a beautiful initiative as well for Cohort 4. Next slide, please. So in addition to the Strong Roots, the community coalitions get funding to develop a coordinated effort within their region, within their region or within their county. They try to work together with their community to raise commitment, to pull together neighborhoods, to support the different parenting educators that are within their region and community, and they want to make sure they're engaging families, that they're hearing from families. They have their fingers on the pulse of the families in their communities. Next slide, please. If you are interested in being part of our community coalition cohorts, you're in luck because we have a Q&A webinar tomorrow, November 5th at 11. We can send out the link to we can send out the link to the Zoom registration at the end today. We have applications that are due on November 15th. So we really look forward to folks applying for this opportunity and to become part of this larger network of Nicepep coalitions. And yes, Sandra, we can get the PowerPoint to print at the end of the training.
Thank you.
Yeah, absolutely.
Thank you. I'm trying to take notes, but it's fast.
No problem. No problem.
Thank you.
We'll make sure you all get it.
Thank you.
All right, moving ahead to the community cafes. This is another part of our professional development that we do with Nicepep and a big piece of what the community coalitions do. So the next slide will show you some of the community cafe series that have been facilitated by those community coalitions. Like I said, Strong Starts is one thing. Community cafes are another thing that our communities do. And, as you can see here, some of our communities did some cafes focused on dads. Others did them focused on resilience, the movie, and talking about, toxic stress. So really it runs the gamut and really focuses on what the community needs based upon what the community is saying. So bottom line is the community cafes, they build community strengths, they promote parent leadership, they promote healthy development of children. So other projects. Next slide, please. So other projects, we have a few. So one is a searchable database. So if you go on the New York State Parenting Education Partnership website, you will see a Find a Program tab. And if you click there, you can do a search of the programs in your county. That include 211 or different parenting programs that are available. There's a whole searchable list. So I encourage you to go in there and take a look. We also have different resources available. One is the new, the Parent Guide, and what this is called is, it's the Starting Life Together New York State Parent Guide, and the Parent Guide is a book that was written by experts here in New York State, and it's for families that have children 0 to 5. So it starts prenatally and takes you through up to 5 years old, and it talks about different developmental milestones, different resources that are available in New York State. So we have these in hard copy. We have them in Spanish available. They're also available on a website, the New York State Parenting website. I'm going to put that in right now, New York State parenting.org. You can find the Parent Guide on there as well. So I encourage you to check that out. We also have on our website specific pages for parents and caregivers. We have specific pages for providers and professionals. And then, of course, as I've said, we have our e-news where we talk about what's happening with Nicepep, different funding opportunities that are available, different professional development training opportunities that are available, as well as, since we are made up of several different organizations. Remember, I was talking about our conveners, Prevent Child Abuse, State Ed, OCFS. We also share about what opportunities those organizations are providing as well. And so it really is a partnership. Next slide, please. So make a gift, make an impact. You can support our work by donating. So if you go to our website, the Nicepep website, you can click the donate button. And really, it's about ensuring that New York's next generation of children will thrive through education, through support, through nurturance of their family systems. We know that development is largely relationship-based, and so we want to take a strengths-based approach to support children and families and communities. Next slide, please. I want to have a special thanks to our partners at the New York State Office of Mental Health who provided the images and the quotes for today's presentation. You saw them, peppered throughout our presentation today. And so if you're interested in copies of these inspiration cards, they're called, you can contact Laura Payak. She's the Director of Community Outreach and Public Education at the New York State Office of Mental Health, and her email is there. And what's really great about these cards is on the back of them, there's a QR code that you can scan to talk or listen or get support if you or someone you know might be having some difficulty managing today, because as we know, it's just consistently inconsistent. So there's also a crisis hotline there as well, so we encourage you to utilize those. Yes, and Jessica Robles, wonderful. Yes, these are so great. They're beautiful. I still have the previous ones here on my desk. I don't know if you can see them. Probably not, because they're sort of there. My background is taking over, but I still have all of them here on my desk, and I absolutely love them. I shift through them throughout the weeks and find a new one, and make that my inspirational quote for the week. So, thank you to Kate Preventer for sharing that with us, and to Laura for putting those together. Next slide, and this is the last slide, I think. So as I said earlier today, please reach out if you have any questions. My name is Kristen Weller, and I'm the co-chair of Nicepep with Tim Hathaway. Tim will be providing an afternoon welcome, and Tim is the executive director at Prevent Child Abuse. I want to shout out to Tamaya Memoli and Dwan DJ Gilmore, who have been helping us today with the behind-the-scenes virtual stage management. And Tamaya and DJ are both very active in Nicepep as well. And visit us at nicepep.org. We'd love to have you. And I think the last slide. Thank you, Tim. So we have about 2 minutes if anybody has any questions. I'll make sure that everybody gets the slide deck. Okay. So we can move into our keynote, which is the next slide, I think. And Tamaya, I'm going to turn it over to you to provide an introduction for our keynote speaker today.
All right. Thanks, Kristen. And Cailin, excuse me, frog in my throat. Cailin, I did make you a co-host so that you can share your screen for your slides. So first of all, welcome everyone. I'm so glad you're here. You were able to join us today. I'm very excited because Cailin O'Connor is joining us as our keynote today. So Cailin is the Senior Associate at the Center of the Study of Social Policy. And she works there to promote better outcomes for young children and their families, with a focus on promoting the protective factors that children, families, and communities need in order to thrive. So this includes coordinating the Strengthening Families National Network of 35 states using CSSP's Strengthening Families Protective Factors framework, and supporting communities in their work to build innovative local early childhood systems. I just want to say that I've had the pleasure of attending several of Cailin's presentations, and you are all in for a treat today. I feel very fortunate that she was available and was able to present for us as our keynote speaker today for the Nicepep Fall Training Institute. So with all of that, Cailin, I will turn it over to you.
Thank you so much, Tamaya, and thank you to everybody on the Nicepep planning team for inviting me to join you today. I'm really happy to be with you. And I hope that we're going to have a good interactive couple of hours together here. I definitely don't want to just talk at you for that long. So we will have a couple points where we'll stop for conversation, but at any point, feel free to type into the chat, just what you're thinking, how you're reacting, or if you have a question, and I will check in on that periodically to make sure that we're catching any questions that you have. I'm very excited to be with you today. We're going to talk about knowledge to action. So really what it takes to implement Strengthening Families in your program. I think a lot of you have probably heard about the protective factors and Strengthening Families before. It might be new for some of you, so we are going to talk about it today. But I think a lot of times what we have is folks who know about the protective factors, but haven't quite figured out the ways that they want to change their practice in response to knowing about the protective factors. So that's what we're going to talk about today. A little bit about CSSP before we get started. In case you're not familiar with us, we are a national nonprofit based in Washington, D.C., although I'm in my home office in Madison, Wisconsin. Several of us work from home even before the pandemic all around the country, but we do have an office in Washington, D.C. Our mission is to work towards a racially, economically, and socially just society in which all children and families thrive. So we focus a lot on thinking about how systems need to change, how communities need to change, and how practice and programs need to change in order to drive better outcomes, particularly for families and children that have been marginalized by public policies and institutional practices. So I could say a lot more about that, but I won't. I encourage you to check out our website if you're just learning about CSSP for the first time, or even if you've been familiar with Strengthening Families for a while, but aren't sure of everything else CSSP does. Strengthening Families is a tiny sliver, actually, of the work that we do. So I encourage you to check us out at cssp.org, and all of that contact information is in the slides, which you will get after the presentation. So what we're going to go through today, first I'm going to talk about what we call the 4 big ideas behind Strengthening Families, of sort of how Strengthening Families is different from other initiatives that come and go, and about the 5 protective factors that all families need. Like I said, I know some of you probably know that and can rattle off the protective factors, but hopefully in talking about it for those who are newer to it, you'll also, be able to do some reflection and thinking about those protective factors, even if you've known about them for a long time. And then we're going to get into the small but significant changes in practice that you can make to help build protective factors. And we will have a breakout during that time for some small group discussion. And then this afternoon, I know you'll have a lot more time in conversation with each other to think about changes in your practice. And I'll share some tools and resources before we wrap up. So that is our plan. We are going until 12:30, just so you know. You need to plan out any logistics. We will be going until 12:30 with about 10 to 15 minutes for a small group discussion along the way. Okay, so the 4 big ideas behind Strengthening Families. And this is a way that we talk about Strengthening Families just to help people see kind of the bigger picture of the approach of it and not just the protective factors themselves. So I'm going to talk through these 4 with a little bit of detail about each. So the first big idea is just the idea of focusing on protective factors. And it's interesting that in 2021, that feels kind of like duh. But when Strengthening Families was developed, which started 20 years ago, it was the child abuse and neglect prevention field, and even the family support field was talking a lot about risk factors and really, offering services only to families that met certain risk categories. That's still the case for some programs, but in general, we tend to talk more now about protective factors, or this other phrase, promotive factors. So I'm going to say a little bit about how those 2 things are a little bit different, but essentially function the same. So a protective factor is a characteristic, whether it's of an individual, a family, a community, but a characteristic that makes positive outcomes more likely even in the face of risk. So it protects a person or a family or community from the poor outcomes that we might otherwise expect because of the risks that they face. A promotive factor in the research is a characteristic that makes positive outcomes more likely, period. So whether you're facing risk or not, these things promote better outcomes. And the protective factors that we talk about in Strengthening Families are actually both. They serve both of those functions, whether families are facing risk or not. They do make positive outcomes more likely, negative outcomes less likely. We tend to use the shorthand of just calling them protective factors in Strengthening Families, but in our parallel sort of sister framework of Youth Thrive, we use the phrase protective and promotive factors more because promotive factors are talked about more in youth development. So in case you've ever wondered, now you know the backstory behind those 2 phrases. And of course, we all know about risk factors, but for many reasons, when we only focus on risk factors, both in terms of who we're going to serve and how we're going to serve them, risk factors get really limiting. We know that there are all kinds of people who face a lot of risks, who don't have the poor outcomes we might expect. And we know there are people who don't face any particular risks that we could pick out, or not very many, who are really struggling. So when we only think about risk factors, we cut out some people that we would want to be serving, and we might target intensive services as someone who kind of doesn't need them as much. And we also have a challenge because a lot of the risk factors that we know of for, whether it's for child abuse and neglect or for poor school performance or criminal justice involvement, a lot of those risk factors are what we call static. So it's a risk factor like low birth weight. That is a risk factor for several challenges, right? Or young maternal age at birth or low maternal education at birth. When we talk about the mother's age, or we talk about the birth weight, or we talk about a lot of other factors, those are set. Those are not going to change no matter what we do. And then there are some that are more dynamic. Mother's education level. That's something that can change obviously over time, and it does for a lot of mothers or parents after they've had children. They still continue their education, but it's sometimes outside the scope of what our programs are focusing on. Another example would be poverty. We know poverty is a risk factor for just about any outcome we're concerned about, negative outcome we're concerned about. And often our programs are not equipped or don't have the mission of addressing poverty. So it's dynamic, but it doesn't really tell us what we should do to help that family. When we think about protective and promotive factors, it gives us things that we can say, okay, social connections, that's something we're going to work on with this family. And we might also work on, meeting their concrete needs. And we might work on advocating for policies that would make it less likely that families would be in poverty. But our focus when we're sitting face-to-face with a particular family is going to be on these protective factors that we know can change and that we know we have some opportunity to influence through our interactions with families. I always like to share this quote that Dr. Carl Bell from the University of Illinois said, where he just kind of summed up the whole situation, which is that risk factors are not predictive factors because of protective factors. So when we know folks who have better outcomes than we would expect or worse outcomes than we would expect based on the risk factors, that difference is because of protective factors. And more we are seeing the science that tells us this, right? We have the ACE study that everybody knows about, and now we've had more studies and more are going on about positive childhood experiences and how those interact with adverse childhood experiences to make this complex trajectory for each individual, where it's not predictive based on your ACE score, what kind of outcomes you're going to have. It is much more nuanced than that and complicated by positive things, protective factors, and supports that families or individuals have had along the way. So here you see briefly what those protective factors are. I'm not going to say them right now because we're going to go through them in more detail later. But I always want to mention what those are. So the second big idea behind strengthening families is that it's an approach and not a model. So strengthening families is not a scripted curriculum. It is not a 8-session program that you do in a particular way. It's an approach that can be applied in just about any setting where we interact with families with children. So we always talk about it in terms of small but significant changes. So it's not that you're throwing out everything you've been doing because now you're doing strengthening families. It's more that you're saying, oh, maybe in the way that we, the forms that we fill out about families, we're going to change a few things here and there. Or our first interaction with families, we're going to make sure that we do it this way. So it's not scripting anything that you're going to do, but it's giving you some ideas to make those small but significant changes. One of the downfalls of being an approach and not a model is that you can't be an evidence-based model if you're not a model. So strengthening families is research-based and it is evidence-informed, meaning that it is very much informed by what we know works with families from evidence-based programs and from other kinds of studies and from experience in the field, but it is not an evidence-based or an evidence-based program because it can't be evaluated in that way. There are some programs now that have been built around the protective factors or programs that have integrated the protective factors that are evidence-based programs, because they've, created a program model that incorporates strengthening families, and then they've been able to evaluate it in the way that evidence-based programs need to be evaluated. Another benefit of it being an approach is that it can be applied in many settings, and it is applied in many settings. When Strengthening Families first started, it was called Strengthening Families Through Early Care and Education, and it was really designed to be used in those settings where providers were interacting primarily with children, but had opportunities to connect more with the parents, and could make these changes in their practice to reach all families. Almost all families use early care and education. It's certainly not a stigmatized or a group based on risk factors. So the idea was that it could be applied there. But as soon as CSSP released Strengthening Families, home visiting programs said, well, we're going to use that too. It just makes so much sense. It'll help strengthen our programs if we think about in terms of these protective factors. And then child welfare jurisdictions said, well, we want to use this too. This will be such a more positive way to interact with families. And so you immediately started having more and more settings saying, well, it's called Strengthening Families Through Early Care and Education, but we're going to use it in this other setting. So we changed the name. Now it's just called Strengthening Families because it's being used in so many places. And every year we hear about new settings that are using Strengthening Families that were never in the original conception of the approach, but where the approach can be applied. So that gives it so much flexibility, and that's really exciting. That also leads to that little orange, what are these, hexagons? Anyway, the little orange shape there, cross-sector coordination, which becomes really critical when you're applying this idea across many settings, because we really want to think about if the pediatrician's office is using a Strengthening Families approach, and the child welfare jurisdiction is using a Strengthening Families approach, and the early care and education and home visiting and all these other settings, the Family Resource Center, are all using the protective factors approach. That's nice for parents to get the same kind of message and reception everywhere they go. But also it's nice if they all know that each other are using that language because they can make better referrals. They can better connect around, oh, there's a need in this part of our community that doesn't seem to be met. How can we all work together to figure out what we can do better? Those kinds of things that you can do with cross-sector coordination that are really a benefit of this approach being used in so many different places. So we like to use this image that we call a daisy, although I think it kind of looks like an atom with the nucleus in the center there of families and protective factors. What you see around the edges are all these different systems that touch the lives of children and families. Most families interact with multiple of these systems, not all of them, but most would touch several of these in the normal course of a child's growing up. And when they're all speaking the same language, when they're all connecting with each other, that family's experience is going to be so much more positive. And then the other thing that we're always trying to keep in mind is that families wouldn't say, yes, I'm raising my children in such and such, school district and such therapy program and such family resource center, right? They will say, I'm raising my children in this town, or maybe this neighborhood, or maybe this county, depending on, your setting. But it really is, families live in communities, not in the context of the programs they interact with. And so we need to think about how, as an entire community, we can be promoting protective factors, making sure parents know where to turn for support, making sure that places are family friendly and strength-based across the community. So we're talking to faith-based communities, we're talking to the grocery store owner, all these different places that can be more family friendly and can understand that they all have a role in supporting families. So when we think about a community where that's in place, what would that really look like? We like to envision this as a family support system where the settings that families go to every day have some understanding of family strengths. They're strength-based, they're child and family friendly. So the picture you see here looks like a, maybe library story time. The librarian maybe doesn't have to have a specialty in family support, although some of them do, but the librarian does know enough to like notice a family that might be struggling and needs some more support, or to raise up some issues around parenting in the context of having a group of parents sitting in a circle with their little kids, and can kind of provide that light touch family support. And then you have the dedicated family support resources, which I would include family resource centers, but also early care and education that's done well, Head Start, those types of programs that really focus on the whole family. That those programs are well connected, so the librarian knows where to send somebody, or to bring somebody in to talk to the group, and that's a strong element in the community, and families know how to get that support. And then there are connections to more intensive services when needed. So the family that does need children's mental health support, or needs a domestic violence intervention, needs whatever types of support, they can get to that because they're already tapped in to these other systems that are lighter touch and non-stigmatized. And then we have navigation supports to help families make those connections, because we all know that once you're involved in more than one system, or when your family is dealing with a health challenge on top of whatever else was already going on, like we need more support in finding out how to get the services we need, and that navigation can be really critical. And then you see the arrow across the bottom that shows that language of protective factors going across all of these systems, and being a way that all of these providers can understand their role and talk to each other about what they're doing. The next big idea, sorry, I thought I had another slide in here, but it must be coming later, so I'm not going to spoil it. We'll just see when it comes up. So the next big idea is about a changed relationship with parents. And I know for some of your programs, it's really not fair to say it's a changed relationship, because particularly folks who consider themselves parenting educators in whatever context have hopefully had a positive relationship with parents all along. But we know that in a lot of systems, parents have had either adversarial relationships with service providers. So child welfare system is often adversarial, or it ends up being that way, even though no one actually wants it to. But even in like early care and education, a lot of times, nobody goes into being a preschool teacher because they love adults, right? People go into that work because they love the kids. And sometimes the parents are the people who don't pay the bills on time, the people who aren't following through with potty training at home, whatever it might be. They're not, it's not a positive relationship. So when we think about a strengthening families approach, we really want to understand at all levels that the parent is not just a member of the team that's working towards good outcomes for the child, but the leader of the team that's working towards the good outcomes for the child. They're the decision maker. They may need support and may need some guidance on figuring out the right decisions to make for their child, but they are in the driver's seat. And so when we talk about parent engagement, that big wheel is about engaging with their children. That's the most important level of parent engagement, is that parents are engaged in parenting. They are, and parents, almost every parent, this is true, that they are engaged with their children. They can use some support in ways to be more positively engaged with their children, or just new ideas for new things to try with their kids. But that is the most important level of parent engagement. And then we get into parents shaping programs and services. So parents who are willing to, who see that they are recognized as partners and as the leaders in their children's and families' lives, who then will help to shape the programs that they're participating in, either because they are really enjoying it and they want it to work for more parents and they want to improve a program and just help keep it running, or because they've had a bad experience and they're saying this needs to work differently and I'm going to advocate and step up and do that. And then we get up to the parents who are influencing policies. These are the parents that are saying, yeah, I'm going to show up and testify at the legislature about why we need this policy that's going to serve families better, or why this system needs to change. Oftentimes, I think when we talk about parent engagement, we look right to that influencing policies, like, where's a parent I can bring with me to this big meeting? Or you know, we need a parent representative at this high level decision-making table. And that's great. But if you haven't done those earlier levels of engaging parents so they know that they're valued and welcomed, and have had maybe some coaching and support on how to have their voice heard in these kind of settings, it's usually a negative experience to bring them to a big, you know, come sit at a meeting with a bunch of people in professional suits and fancy titles and ask a parent to just jump into that mix. So there's some scaffolding that we need to do. This is the slide I thought was going to come earlier. This is one of my favorite quotes from a New York State hero of mine, Dr. Yuri Bronfenbrenner from Cornell, who said, "Children don't grow up in programs, they grow up in families and in communities." So when we're trying to improve outcomes for children, if we're not doing that through families and in communities, it's not going to be very effective. I wanted to share a couple of other resources that CSSP has about parent engagement. The first one is a toolkit called Ripples of Transformation, Families Leading Change in Early Childhood Systems. Some of you may be interested in this. Some of you may have seen it before, but it really was developed by a group from several communities that are part of our Early Childhood Learning and Innovation Network for Communities, or EC-Link. Onondaga County is one of the members of that group. I believe we developed this toolkit before Onondaga joined, but they have been using it. And also the Manifesto for Race Equity and Parent Leadership in Early Childhood Systems, which was actually written by parents from EC-Link communities who came together for meetings about parent leadership and how to implement this Ripples of Transformation toolkit, and really landed on the critical connection to race equity in that work, and decided to write this manifesto, which I think is awesome. So those links you will be able to get in the slides when we send those out afterwards, but you also could just go on the CSSP website. If you Google manifesto, this is the only manifesto we have. if you search on our website for manifesto, this will come up. Or if you search for ripples, it's an only document with ripples in the title. Okay, so the fourth big idea is about alignment with developmental science. And this is really about how strengthening families helps providers to keep their practice in line with what we know from developmental science. We know sometimes people have been in the field for a long time. They're not reading the latest research, but they need opportunities to check in on what's new and make sure their practice is aligned with it. So strengthening families aligns with developmental science in these three ways. The importance of early childhood and adolescence, that's actually why we have the two parallel frameworks for parents of young children and then for adolescents, recognizing how much development happens in those two periods. Also really emphasizing the role of nurturing relationships in brain development and thinking about how we can promote those foundational relationships that drive all other development, particularly in infancy and early childhood, but throughout life, those nurturing relationships are so critical. And finally, really thinking about the effects of trauma and adversity and understanding what that means for how we provide services. So as I mentioned, we have these two parallel frameworks. Youth thrive in strengthening families. The idea is that when children are young, we really focus on their parents' protective factors because the parents are so critical to the children's development. And then as children get older, we start to think about their own capacities and their own protective and promotive factors. Not that the parents aren't just as critical, but we actually want to do both at that stage of life. And this graphic shows these in a circle because many of those young people will become parents and carry those protective factors into their own parenting. And in fact, one of the ways that we see strengthening families and youth thrive being used together is with young parents. So how do we pay attention to the developmental needs of a young parent who is still in the throes of adolescent or young adult development, but also needs to be the best parent they can to support a young child's development? That's really an intersection where we can use both of the frameworks together. Okay, I'm going to catch my breath for a second. Try to distract my dog who suddenly decides he needs to talk to me, and see what we've got in the chat before I jump into all of the protective factors. Oh, I see a comment from Lori Black. Nice to see you, Lori. They are using the Parent Manifesto in Onondaga County, and I'm sure Lori could tell you more about that anytime you want to hear about it. We will definitely be sharing these slides. I see the question from Alexis. Those will be sent out after the session today, I believe. Okay, let me get a drink and then we'll jump into these protective factors. Oh, I spilled. Good look. Okay, so these 5 protective factors. I want to start by saying these are not the only protective factors. There are a lot of other things that have this protective and promotive function in families' lives and in individuals' lives. But these 5 were chosen from the research, pulled from the research, because we were, and using the royal we here, I was not on the team at CSSP at the time, but we were looking for which protective factors would both have a really positive effect for children.
Well, I'm just finishing up the in-kind and going through all this paperwork and everything.
Okay, looks like maybe we got that muted. Thank you. So these protective factors were selected particularly because of the opportunity to influence them in the types of interactions that we have with families in human services, in early care and education, and in other settings. Because, like I said, we're focusing on things that are dynamic, things that change, and that we can change over time, and things that can be changed through our standard types of interactions with families. So you might see other lists of protective factors, or just think of some protective factors that you don't feel like are represented on this list. I've never seen any protective factors that contradict this list. You can take the ideas behind this and group them in different ways. I should acknowledge some of our federal partners use 6 protective factors, where they've separated nurturing and attachment.
For January.
Okay, somebody needs to be muted. I'm sorry. Okay, thank you. And just so you know, when we talk about the protective factors, it's not a conclusive, exhaustive list, but it has been very helpful. And as we always talk about, it's very convenient that there are 5 protective factors, because we have 5 fingers on our hands, and 5 is an easy number for us to remember. So let's jump into what they actually are. The first protective factor is parental resilience. And this is about managing stress and functioning well when faced with challenges, adversity, and trauma. Resilience is a concept that I think people are much more familiar with now than they were back when this framework was developed. And sometimes it has some connotations that I don't love, that are a little bit more individualistic than we would hope them to be. So when we talk about resilience, we're talking about, and particularly for parents, a parent's ability to be the parent they want to be, to show up in the relationship with their child the way that they want to, regardless of what else is going on around them. And this doesn't mean that we're saying, there's going to be all kinds of challenges in the world and you just have to be resilient. We also want to minimize those challenges, and some of the other protective factors are about reducing those challenges and stress. But we do want the parent to be able to still relate with their child, still be that nurturing and responsive parent, even when things are going poorly and when they're stressed. So this is one of the most important protective factors, and in some ways it's an outcome of the other protective factors being in place. And the other thing I'll say is we see a combination of, there's actually 2 different things within parental resilience. One is that sort of everyday resilience. So, showing up to work and paying the bills and doing what you need to do, even when times are tough. And then there's that showing up as the parent you want to be, even when times are tough. And I think we've all dealt with parents where they might be stronger in one of those ways than in the other. So it might be that their parenting stays really strong, but they aren't always being as resilient as they need to with other everyday challenges, or it might be the other way around. And we want to lift parents up to be able to do both so that they can be there in those relationships with their children. And on each of these slides, you'll see a pretty cool graphic, which is a poster that Strengthening Families group in Northern Michigan created. Those are actually available to buy as posters if you're interested. They've translated them into Spanish and Mandarin and maybe a couple other languages by now. So I'd just like to show them because I really enjoy the graphics they came up with, and the wording that they put on these was developed by parents in Northern Michigan who said, well, resilience is kind of a long, complicated word, but we have a way of talking about that that's going to make a little more sense to us, where they said exercise flexibility and develop inner strength. And I love the image of a slinky there as a symbol of resilience. Okay, so the next one is social connections. Social connections is a protective factor in so many ways because we all need relationships in our lives, both for emotional support, also for informational support. So like when you say, I think my kid might have a speech delay, who do I talk to about that? Somebody who knows that is a critical help. So that sort of informational connection. Instrumental support in the sense that, who are you listing as an emergency contact when you sign your kid up for childcare? Who do you have that can be that support, for that help for you when you need it? And then spiritual support of who helps you feel more connected to others and to the universe and whatever you might define in your religious context, but just who gives you that connection of being part of something larger than yourself. All of those are important elements of social connections. And I also always like to give the example of how important it is as a parent to be around other parents with kids maybe around the same age so that you can learn about parenting, because you see like, oh, okay, that's a way to talk about that issue with, of one parent to another child, where you think, oh, okay, yeah, I could try that. Or you think, whew, that did not work. I'm not going to do that. Or get insight into things you've been trying or want to try. So it can just be really valuable for parents to be around other parents. And we know how much social isolation is a risk factor for all kinds of poor outcomes. But when we think about social connections, we can come up with things that we might be able to do to help parents build that up. Another thing I'll say about social connections is that what we often find is parents who are socially isolated are often socially isolated with some reason. So oftentimes it's an intentionality that they were in some toxic relationships, or they were in a social group that wasn't supporting positive parenting for them. And so they've made some cuts, they've cut some people out or limited contact with people because they're trying to do the right thing for themselves and their kids. But we need to help them fill that void with positive connections, because having no social connections is just as risky as having poor social connections, right? So sometimes there's a need for just role modeling and role playing about what a positive interaction looks like. Some people come into parenting without ever having had very many positive relationships, and so some coaching and support on how to find potential friends, how to make friends with another parent at the playground. That kind of support can be really critical and can kind of help a parent along the way towards building those connections. Okay, the next one is knowledge of parenting and child development. And this is really about understanding child development and knowing strategies you can use for behavior management and for promoting healthy development. I love this image from the parents in Michigan with this brain that's also a tree, and their wording of learn to be your child's expert. And I think a lot of times what we see is folks have a general sense of parenting, have a general understanding of child development, and then they have a child who's not developing in a typical way, or who doesn't respond to the parenting that they were raised with. and then they're kind of stuck. So we need to give people more tools in their toolbox to use with parenting. We need to help people understand that, you know, your child, for whatever reason, might need a different style of parenting, or this type of discipline that worked with your other kids might not work with this child. And so you need some other ways to try this, other things to try out. And I think a lot of our programs, this is sort of our wheelhouse, right? Knowledge of parenting and child development is what we do, parenting education, right? But we also need to understand that there's so much nuance to that of helping people apply those skills, helping people to get to the right, you know, the right program or service that's going to help them with what they need in particular. Oftentimes we see, you know, in the child welfare system, sort of take a parenting class is this sort of generic demand, and no explanation of sort of why that's going to address the issue that brought the family to the attention of child welfare. And sometimes it ends up being kind of checked off a box instead of really used in a productive way to say that let's think about what your family really needs and what we could do that would help meet that need. So being thoughtful about where and how we build that knowledge, I think, can be really important. Okay, the next one is concrete support in times of need. And I'm trying to check the clock. I think I'm doing okay on time. Concrete support in times of need is a really basic protective factor that, you know, we often think about formal services, the food pantries, the unemployment insurance, those types of concrete supports that are incredibly critical. And then we also get a lot of concrete support from our social networks. So like I mentioned, you know, who's the emergency contact that you list when you sign your kid up for childcare or school. That's a concrete support as well, but it gets kind of blurred in with social connections. When we have strong social networks, we get some of those concrete needs met. And some families have that organically, and some will need formal support in a lot more ways because they just don't have that organic network. So when we think about concrete support in times of need, this is also where we start to think more about policy. Like it can be hard to think about how policy does or does not promote social connections for families, but when we think about concrete support, it's very clear. So the current fight in Congress about paid leave, right? Can families take leave to care for a newborn or a newly adopted child or another family member who's having a health crisis? That's a concrete support in times of need that we know is so critical. And that's a policy opportunity, but it's also something that, you know, doesn't have to happen at the federal level, may or may not happen at the federal level, but can happen locally or in states or by individual employers, that we can say, we know this is important, here's how we're gonna help meet that need. So there's a clear connection to policy with the concrete support. And then the final protective factor is social and emotional competence of children. And here we're talking about really the adult, the family, the parent role in helping to nurture that social emotional development. So helping children develop the ability to communicate clearly, recognize and regulate their emotions, establish and maintain relationships, all of these foundational relationship issues that we know are so critical. And that when we're providing services to families, we can do that in a way that promotes those foundational relationships. We can also think about policies that allow that allow and promote more of those types of interactions. But really a lot of it is in how we interact with families. In early care and education, some of that is role modeling. So just giving families the words to use to talk to their children in a way about using their words and expressing their emotions. And then, you know, transferring that to the parents for them to be able to use it at home as well. But also in a lot of other settings where we're interacting directly with the parents. In home visiting, we can model the eye contact, the serve and return interactions with an infant. That's a lot of what we do in a lot of our programming, is to help families see what what comes naturally and what they still need to learn a little bit more of, and how they can do more of those interactions that are so critical. Okay, those are the 5 protective factors. What's showing on the screen now is kind of a fun graphic also from these folks in Michigan. Sometimes in person, we do this as an activity at your tables where you trace your hand and think about which finger would stand for each protective factor. Here you can see one of the ways that a group decided to define it. It's always a little bit fun to think about. And I thought we could stop here and just ask either in the chat, or if you want to unmute and speak, if you want to share some about how you're using Strengthening Families and any questions that you have about it. Oh, come on, don't be so shy. I know some of you are already using it. Or maybe you have questions. Or maybe you just have a reflection on where you would assign those protective factors to the fingers on the hand.
I mean, I'll talk.
Yeah, go ahead, Sarah.
Hi. So I'm with Quality Stars New York. I'm with the state's Quality Rating and Improvement System in early childhood education. And we use the Strengthening Families self-assessment tools for family childcare providers and for childcare centers. So they're written into our Quality Rating and Improvement System standards.
Great.
And so that we ask them to self-assess with the tools, and then we ask them to create a couple of action plans based on their self-assessment.
I love that. I'm going to talk a little bit about that at the end too, about that, how the self-assessment can help you with action planning. So I'm glad to hear it's being used in that way. Thanks, Sarah.
Mm-hmm.
And I saw Belinda typed in, we don't currently use it, here for information, which is great. Love that you're here to learn. And Samantha says, as a home visitor for healthy families in Steuben, Livingston County, we are a strength-based program. That's great. I think this fits so well with home visiting and with a lot of the other programs that all of you are from. While we're on this slide, I did see another question about the slides. We will be sending those out. They'll come out afterwards, and you'll be able to have all these notes. Okay, I see Jackie wrote in, programs supported by the Children and Families Trust Fund are using the Protective Factors Survey to evaluate our programs and determine how we're impacting the protective factors in our work. That's great. And definitely using the protective factors as outcomes is something I think is a great idea for gauging how we're impacting families, as well as for putting that in terms that are comfortable for the families, that make sense. So I really like using those tools around the protective factors. And Susan adds that in her experience with parents, it's often true that they benefit from more information on typical child development, which reduces unrealistic expectations for children's behavior. That's true, so important. We do see cases of abuse or neglect where parents had inappropriate expectations, that they thought their child should be able to do this thing and they got really mad that they couldn't, or that they thought their child was okay to stay home alone, but they actually weren't. So understanding typical development is very important. And then understanding atypical development, if your child is on a different path, is also very important. Okay. A few other notes, people saying hi to each other in the chat. Love to see that. Okay, one more comment I'll make while we're on this slide is, in case you do encounter folks who are using the 6th protective factor and wondering how that all fits together, some folks use the 5 fingers for the 5 protective factors we've been talking about and put nurturing and attachment on the palm, because nurturing and attachment is really so critical to all of this. And that's how we've always seen it. If anybody has questions about it, I could go on about how the 6th protective factor came to be and why we haven't added it in our own framework. But suffice to say that we believe nurturing attachment is present throughout all of these, and is critical to child well-being and family well-being overall, but is already represented in the other protective factors. So that's enough about that. And I think we'll move on. Thank you all for sharing in the chat, and for Sarah for speaking out loud. I appreciate it. Okay, so we're going to continue. We're going to start thinking about what this all means for your work. So we can understand family strengths. We can list off family strengths, but what does that mean for how we actually do our work? Let's talk about some of those small but significant changes. So when this slide, I know there's a lot going on, it might be hard to read, but I just wanted to demonstrate that when we talk about the protective factors, what we've identified are what we call everyday actions related to each of these protective factors that you can take either in a program or in, talking to your neighbor on the street corner, that these everyday actions that we then in the self-assessments get into more detail about what that actually looks like in a specific type of program. But we believe these apply across the board. So the self-assessments are structured around these everyday actions, and that is one approach that you can take to get some ideas for things you could be doing. And even just in reading these, you might say, oh, provide opportunities to try out new parenting strategies. Okay, so we need like practice time and maybe homework from between the two sessions, between sessions of a parenting program. Go home and try this out, come back and report on it, that type of thing. Some of these everyday actions can just prompt ideas. And then within the self-assessments, we list a lot of ideas related to each of them. But for today, we're going to talk a little more globally, not getting into those everyday actions, but just thinking about how we can work with intention to help families build strengths. Because I think in family support and parent education, we can draw the lines between like, oh yeah, we need to think about social connections. We do this, this, and this. Oh, this program goes to this protective factor. We can kind of do that after the fact, or we can do it really broadly. But when we try to think more intentionally, like what are we actually going to do differently? What could we do within our existing services? What might we add? Where do we need to start making more referrals out? What protective factors are we not targeting that we either need to refer out or enhance our own services? Which families or community groups could we serve better if we really focused on strengths? Thinking broadly as a community, how are we supporting family strengths, and what's our role, my organization or myself personally, what's my role in supporting that? So we're going to think about all of those things and think about that intentionality of how we can change our practice. The slide's not advancing. There we go. So we developed this wheel. I don't know what this is, bubble system. I'll just call it a wheel, about all the different ways we interact with families in which we can take a protective factors approach. So these are all things that I would assume you do in your programs to varying degrees and in different ways, depending on what type of program it is. But most programs do all of these things in some way. And so we can think about how we take a protective factors approach as we go around this wheel. So we're going to start with how we engage families, how we assess children and families, whether that's formal or informal, how we deliver our services, how we address challenging behaviors or parenting concerns, how we organize family events, how we refer families out, and how we take care of ourselves. So those are the areas we're going to focus on for where we can make these small but significant changes. All right. The first one is about engaging families. And really every interaction is an opportunity to engage, but we're going to think about sort of mostly that first impression that matters a lot, how we welcome and engage folks in our programs. So a lot of it is just about how you structure that relationship. I think a lot of times in child serving programs, we tend to just call somebody mom or dad and ignore them as a person. That's not how we want to structure our relationships. We really want to treat each person as an individual, be you know, intentional and let them know that we are here for them as well as for the child, all of that. We want to actively welcome and engage fathers, grandparents, and other important adults. I think we often default to the mother, and a lot of times when we talk about parent engagement, how we interact with parents, we default to thinking about the mother, and that's that comes through to people who are not mothers in the children's lives. They don't feel welcome or valued. So we need to be very intentional about that. And then we also need to conduct targeted outreach to isolated families and underserved groups, whether that's you know, within a program that we already have, where we say we're holding an event, we're just going to invite everybody and see who shows up, where we really need to be more specific. But then also in terms of services that are offered in that way, whoever shows up can participate, but we need to be really careful about making sure that everyone feels welcome, that everyone knows about this, that everyone can get there, and really pay attention to patterns and who attends our programs and services and who doesn't, or who comes once and doesn't come back. And what can we do to do better with that? So in all of our interactions, we can think about that, but a lot of it is that sort of how do we first make contact with folks? Sorry, my voice is getting gravelly and my coffee's getting cold. So both bad things. Got to keep up with that. Okay, so the next area of practice is how we assess children and families. And depending on your program, you may or may not do a formal assessment. If you don't do a formal assessment, you probably still do some intake or some kind of mental sort of like, let's see what this family's needs are. I apologize for the dog, he's being loud. So when we do have formal assessments, it can be really powerful to include protective factors. And I'm saying powerful because that shifts things both for the provider, the person who has to fill out this form. If that form starts with strengths and starts with, you know, protective factors and what do we think this family, where do we think this family is thriving? Where do we think they need support? That can be powerful, but also for the family themselves, to the extent that they know what they're being assessed on. If it is strength-based, that builds a relationship in a much better way than something that is deficit-based. And even when we, oh, and I love this comment from Jackie, engaging families in assessing their own needs, certainly, and that is a much easier and more positive conversation when it starts with their strengths. Even when we need to address deficits and risks, starting with strengths and saying, okay, this is where we're starting from. You're great at this. In the past, you've gotten through hard times by doing this. Let's look at what you're going to do now, what you're facing as a challenge, and how we're going to help you get through it, is much more positive than just like, hi, nice to meet you. What's wrong with you? Right? Like, that's not how we want to engage families, either in verbally that they actually know about, or even in ways that they aren't told about. Assessment also means regularly asking questions and observing what's going on with a family. So it's not just that you filled out that intake form 6 months ago and haven't thought about it since, but that you're, you know, observing what's going on and saying, oh, you know, I know you were concerned about grandpa's health. What's going on with that now? And is he still able to help, you know, with transportation for your preschooler or whatever that might be? And then sharing information with families. A lot of times when we're doing assessments of children in various settings, parents may not know that assessment is being done or may not be given access to the results. And parents are hungry for that information, right? If you did an ASQ observation of a child, give the parents that, you know, ideally talk to the parents about it, have the parents do the ASQ or sit together and do it. But even if it's not happening in that kind of context, let them know what you found. If you found totally on track for development or ahead of the milestones in some ways, share that, obviously. If you found some red flags or concerns, share that, obviously, right? Like parents want to know this stuff and they have every right to know this stuff so that they can be, like I said, in the driver's seat, making decisions for what needs to happen with their child. The other thing that I'll include here is, I think often when we have a particular child we're serving in the family, we might not have any way of assessing the family larger picture, sort of who else is in the family, who else is in the household, what other needs do they have. And sometimes we don't do that because we don't provide the services that they might need. And it's like not great to ask a question if you don't have a good way to respond. So I always think of a pediatrician who had been in a smaller clinic and then moved to a hospital that had a food pantry in the basement. And because there was a food pantry in the basement and he could write a prescription for food after an appointment if needed, he of course started asking every family whether they had enough food at home. But when he was in a small clinic with no resources to provide, he wouldn't necessarily ask that, because if they say they don't have enough food, then what are you going to do, right? So that kind of question and asking, we need to ask those questions and figure out how we're going to respond if the answer expresses a need. Okay. Next is about how we actually deliver programs and services. So we always want to be following the family's lead. And I know when we're in a childcare setting, we kind of have our curriculum, we have our we have our daily schedule, we have we know what we do with the kids, but engaging the family in that in terms of what their goals are for their child's development, what their concerns are, that can still affect how you interact with that individual child. So developing plans in partnership with parents, that's much more obvious than some of the other types of services. Providing connections to other services as requested or as you see a need for and can open up a conversation. So not letting something slide because it's not a service you provide, but rather saying, oh, you're struggling with that. Let me give you the number for the Family Resource Center because I think they could help you with that. Or let's sit together and call the Family Resource Center. We can figure out how they can help you with that. Creating opportunities and coaching on skills for social connection in the context of other services, I think can be really important. As I mentioned, sometimes we're dealing with, we're serving, really sorry about this dog. I tried to trick him into taking a nap this whole time, but he outsmarted me. The social connections can be a challenge where families are socially isolated and don't really have the skills to build social connections. So we might put them in situations where we think they have the opportunity to form social connections, but if we haven't provided some coaching and some hand-holding, it might not happen, right? So we can offer a parenting education class that say it meets for 6 weeks every Thursday night. And by the end of those 6 weeks, some parents are going to have added each other as contacts in their phones and be planning a play date and become social connections for each other. And some are not, unless we really help them to do that. So where can we be intentional with saying, it's not just that you've been in the same room with somebody for 6 Thursday nights in a row, and now we say you know each other, but some folks need more guidance than that or more nudging. And so how can we do that? And then how can we coach on those skills when it's appropriate and when we're in that relationship with a parent? As I mentioned earlier, talking about social connections, it comes easily to some people and it really doesn't to a lot of people. So we need to find ways to provide that coaching in the context of our services. And then again, thinking about the developmental needs of all the children and adults in the household, not just the one that is the target of your services. Because we know that for the family to thrive, everyone in the family needs to have the support they need. And so if we see a need, just knowing who in the community can provide a service can be really critical. That can help parents get what they need for their other child that they hadn't hadn't figured out how to get a service they needed quite yet, and you could be that connection. Okay, sorry, getting to the next slide here. The next one is how we address challenging behaviors and parenting concerns. And this is one that, again, I think when you're parenting educators in whatever context you're in, this might come pretty naturally, but it can also be helpful to spell it out, what this looks like. So I really like this little 6-step process that we mapped out here about why we don't just jump into, oh, you have a parenting question? Here's the response. Here's what I always say about that issue, right? We want to start by expressing empathy. If somebody's sharing a parenting challenge with you or a behavior their child's engaged in that they don't know what to do about, that's a hard spot to be in. Even if it's something that we've seen 100 times, they haven't, and they are struggling. And maybe it's something we haven't seen 100 times and it's really, really challenging. We need to start by expressing empathy. That's just key for establishing a relationship and setting them up to be open to what we're going to share. And the next thing is about asking good questions. So we need to know, like, oh, how often is this behavior happening? Is it only happening at home? Is it happening when you're out in public? Is it happening at childcare? You know, how does the child respond to different things you've tried? What have you tried? How long has this been going on? You know, all of those kind of questions, because any information we're going to provide is useless if we don't actually know what they've already tried or all these other context points. Then we can go to providing the information and perspective. We say information and perspective here because sometimes it is actually just perspective, which is like, that is very typical for 8 weeks old, and next week is going to be better. That might be how much they need, right? Or it might be a lot more than that of, you know, the perspective might be like, actually, at 4 years old, that is an unusual behavior to see. And maybe we need to figure out how to get you some more support to deal with that. You know, that kind of perspective is really critical. Understanding what's normal, what might be a red flag, all of that. Then working together to develop strategies, not just feeding them, these are the things you should do, but, you know, saying, okay, what do you think you want to try? Here's something I saw somebody else do. Do you think that would work? Really that being collaborative in that process, and then coaching, modeling, and mentoring, and then asking how it's going and celebrating successes. Because if we provide that information and perspective and then never check in again, you know, obviously sometimes that's going to happen. Somebody's going to call the warm line and we're going to do these first 3 steps, maybe the first 4 steps, and then we never hear from them again. That's fine. But when we can, we want to then get into, okay, well, how'd that go when you tried this new strategy for bedtime, or, you know, managing a transition that has been hard in the past? How'd it go? What else do you want to try next? There's a lot of conversation we can have, and we can celebrate the things that are working and the fact that they're trying so hard, and really be able to help them solve that problem, but let them be in the lead. Okay, so we are going to get into a little activity now, an exercise to identify the strengths in a family and consider what services we would offer and how we would talk to the mom in this scenario. So I'm going to read this off, and then we're going to put you out into breakout rooms to talk about, you know, what strengths you see in this family. So start those wheels turning, what strengths you see, and what services you would want to offer this parent, and how you might start the conversation with her. So Cailin is a first-time 19-year-old mother. She's been participating in home visiting since about halfway through her pregnancy. Her son Max is 2 months old, or almost 2 months old. One night earlier this week, Cailin texted her home visitor around midnight, said she was going to lose it because Max was crying so much. He doesn't sleep for more than a few hours at a time. He was born small, but he's been gaining weight. She typically breastfeeds every 2 hours, and she says he's been crying a lot for the past week. Cailin is exhausted because she's generally taking care of her son by herself. She doesn't have a good relationship with her parents or with Max's dad, but the dad does come by to see the baby about once a week. And Karin's sister has watched Max a few times, but just for a couple hours. So this mom has been pretty much on her own with this baby for 2 months. Her home visitor encouraged Karin to ask the pediatrician about acid reflux and colic at the upcoming well-child visit, which is already scheduled because he's almost 2 months. In the meantime, she suggested some strategies for coping with the crying, and she gave Karin information about the parent-infant play group at the Family Resource Center and sent you a note saying that Karin and Max would be coming on Thursday. So you are the facilitator of parent-infant play group, and I want you to think about when Karin walks in the door, what are you gonna say to her? How do you want to interact? How do you want to offer some services? And what strengths do you see in this family that can be used to keep her thriving and help Max develop healthy and happy? So we're going to go into breakout groups, and I actually think we're doing really well on time. So Tamaya, if we can give them 15 minutes in the breakout rooms. And we will show you we'll put I think we figured out the technology that we can give you the breakout in the breakout room. You'll be able to see the case study at least for a few minutes while you think about strengths, and then we'll stop showing that so you can just see each other. But, so starting your breakout groups by introducing yourselves, where you're from, say hi, and then start talking about what strengths you see in the family, what services and supports you'd want to offer, and how you would approach Karin when she shows up for playgroup. So Tamaya, are we ready to go?
We are ready to go. Do you want them to assign a reporter to report out?
Yes, we won't go through systematically and have everybody report out, but if you can have somebody in your group who's ready to share something, when we come back, we will have an opportunity to share. Not everybody has to. So
perfect.
Keep that in mind.
Perfect.
Welcome back. That number's still climbing, so we'll give it a minute. Okay, who wants to share something from your conversation? What were some strengths that you saw in Karin and her little family? Feel free to unmute yourself.
One that she's accepting of home visiting. Like some parents will decline the help. She breastfeeds. That's tough. I'll tell you, I have 3, so that was tough. So I commend her for that.
Thank you, Saisha.
To piggyback on that, it's just her ability to seek support even while she was pregnant and could continue to do so was really, I think, one of her biggest strengths, and her willingness to even go to a group. I think that shows that she's got a lot of fortitude.
I like that word, fortitude. Thank you. Other thoughts on strengths that you saw?
She was like responsive to her baby's needs and like responsive to her own state and like reaching out for help.
Right, that self-awareness. It's really important.
Very resilient. Sorry.
Her sister and the baby's father are both involved, and it says a little bit, but they're there. And so helping her think about how she can use that support system. In my experience, sometimes we have young moms who have somebody to watch the baby for a couple of hours, and they go shopping or they clean, and I say, take a nap.
Right. Yep, and the presence of the father is a strength, even if the relationship isn't good. He's there. He wants a relationship and a connection, so that's something to work with. And Alexis, were you about to speak earlier? Was that you?
I was just saying, just repeating what everyone's saying. She's just really resilient. And the fact that she's 19 and, you know, asking for help, and everyone just acknowledging her age in the first place.
Right. And I would also say, depending on the makeup of your parent-infant group, her age may end up making her feel a little out of place, or it might mean that she finds peers there that work really well for her, but it might mean that it takes a little bit more work to find the right group for her. So what did anybody talk about in terms of what services you'd want to provide, or not provide, but offer for Cailin, or what kinds of, how you would approach a conversation with her? We can take both of those at the same time.
I think I would first just normalize this stage of development for her baby. That this is, because we talked about in our group that, we watch these commercials and the babies are so happy and cute, and mommy's always smiling, and that's not really the reality. So especially at her age, this is her only frame of reference, and think that that's something wrong, where it's actually a normal stage of development for an infant at 2 months.
Right.
I think I'd want to be attentive to the context. So I'm facilitating a play group, and she's coming in to participate in the first time. I'm not going to be sitting down and doing a clinical appointment with her. I'm going to be welcoming her to the play group, introducing her to others, orienting her. I'm probably not going to mention that I ever knew anything about her story at all in that first relationship building. I want her to feel comfortable and welcomed into the group.
That's a good point, Jackie. Yeah, it's not, okay, I know your baby's been crying all night, what are we going to do about it? It's the open door, the positive interaction, letting her know you're there to talk.
The group I was in also talked about almost intentionally placing her next to someone that we know would be kind and supportive and helpful to her, and making sure that we use positive strength-based language when we're speaking with her, letting her know that she is doing a good job and pointing out the things that she's doing really well.
Excellent. Yeah, that peer can matter a lot, who she sits next to. Hopefully somebody who's been there for a while and is a little more established, able to provide support too.
I apologize if somebody already said this, but like, I also thought, in the middle of the night when she's upset, she might not like really make a plan and make sure she goes to that group. So if I was the FRC getting that information from the home visitor, I'd probably call her and kind of sell her on coming in for it. Just because I think too often we just give people information and then we don't do the outreach to really kind of influence their decision to do the thing that they were informed about.
I'd also want to take it a step back and make sure that the home visitor got consent for her to share her contact information with me. As a parent getting those calls, it broke trust, and I was less likely to engage with folks that I got phone calls from wanting to engage me in more things that felt like a side thing, like what in the world? So making sure that it's not just, the worker trying to ease their own anxiety, but they've actually done the steps of asking if I can contact them.
Mm-hmm. And maybe even saying, just ask the home visitor to remind her. And then if she doesn't show up, turn back to the home visitor and say, okay, well, she didn't come Thursday. What should we, how do you want to approach this? But, having it go through the worker that she's already comfortable with.
My group also talked about attempting to increase the father childhood involvement, right? So that might be a little tricky depending on her relationship with the dad. But if during that group sometime we could sometime mention the importance of having a father in a child's life and how that can positively affect the mom and the child and the dad, that maybe we could start getting him involved with these groups too, or home visiting.
Yep, very important. And maybe the FRC has something specific for dads that could say maybe he can bring the baby to this event, give you a break and let them do something. Because oftentimes dads in particular, and young dads in particular, wouldn't know what to do with a baby, right? It's sort of a, here's this baby. And so having an event to go to and some coaching can be really helpful.
We also talked a little bit more about the intentionality of the playgroup. Wendy touched on it somewhat, but we also talked about what resources to have there, whether it be flyers or handouts or resources from some community, referral places, or some intentional sharing and something, maybe you start that conversation if you've had experience, and hopefully the people in your playgroup have different of ages of children. So maybe some people have been through it and are kind of past it, and not calling her out or having an individual conversation, but having some intentionality around what's planned at your playgroup and what discussions you're having.
Yes. Thanks, Brenda. Very important. Okay, anybody else want to share before we keep moving? I hope that was a good exercise. Maybe a similar scenario to one that you've encountered in your work. I think most of us have met Cailin or been Cailin at some point, and can relate to that story. So, all right, we are going to get back into this, the wheel, as I call it, for no good reason. But to look at some of the other ways that we engage with families in our programs, which are a little less on that path of the direct, the one family's involvement. But when we think about organizing family events, that's something that a lot of our programs do, and that we know can be really important for social connections and just for engaging families that might not have been engaged in our services otherwise. But there are ways to do that well, and there are ways to do it less well. So when we do that with a focus on protective factors and true authentic parent engagement, we really want to think about ways that we can meet some family needs and include some fun at the same time. So maybe we're providing some parenting education or some concrete support, or even just a meal, which is a form of concrete support, in the context of doing something that's more fun. Making it fun, I should say. That we're really partnering with parents so that they can say what's going to work for them and families they know, and what they've got their finger on the pulse of, sort of, oh, like nobody would be able to come if it was Friday night because this is always happening on Friday nights. And they just know more sometimes about what's going on with families with kids the same age as theirs. And they'll also know what would be appealing. They might have just some fresh ideas that we haven't thought of in our own circles. And then really think about removing obstacles to participation. And some of those obstacles are like transportation and food. And if you're trying to get just parents, then obviously you need to provide childcare. If it's parents and families together, you still might want to provide some childcare or some supervision of kids so that parents can be a little more free to make those social connections. But then also with isolated families, the obstacles to participation could be, that they have some social anxiety, or they haven't been to an event in 18 months, like a lot of us, and might just need a little extra hand-holding. You might need somebody to call them individually and say, hey, I really hope you're going to come to this event, or give them a role if they're willing. Say, can you be the greeter, or could you help with this particular task that gets them more committed to showing up, and also maybe eases some social anxiety, that it gives them something to do and not feel like they're just standing there, not sure how to make conversation. And then in the moment, helping people make conversation. I bet most people who go into parent education are extroverts. Most of us like talking to people. We have at least a lot of practice in it, even if it's not our natural setting. And so be that social butterfly and flit around the room and make sure people are having conversations, be the hostess with the mostest, and get out there and really make those connections, because some people will really struggle with that, and they could come to the event and walk away not having gotten much out of it. So we want to bring isolated families along and make sure that they have a way to be a part of what we're doing. Then when we're making referrals, I've talked a lot about referrals, and I think you probably all do a lot of referrals, but one thing is just to know what's out there in the community. So for staff members to really know, and to have lists of available services that you can share with families that are, organized by neighborhood or by protective factor or by type of service they provide. But really just, some communities have a printed map, some have a website. There's a lot of different ways to do that. But then also for yourself and your staff to get to know other service providers. So it's not just, I know that this agency provides this service, but I know Jennifer at this agency, and we're going to call her and make sure that she's going to be able to help you, right? So it's much more individualized, and while respecting confidentiality and all of that, still just knowing that you know somebody there that you can say, I'm going to make sure that you get connected to the person who I know can help you. And then making those warm handoffs. So that's where we're not just handing them the information, but we are walking them to the door. We are making the phone call together, or we are telling the other provider that we've sent somebody their way and following up on whether they got the service, and making sure that the need was met. Maybe we referred them somewhere that they never went because it was, their bus line didn't get them there. It was going to be too complicated to get there, or they made a call and the person who answered the phone was really rude and they never called back. So we need to follow up and say, well, maybe there's a different provider, or maybe I can help you get there, or somebody was having a bad day, let's try again, whatever it might be, that we really follow up. And the key there is that when we have a relationship already, the family is so much more likely to accept help from us, but we can't provide every service. So we need to build on that relationship to make sure that those needs are getting met. And I'm throwing treats to distract my dog. He's not having a good day. Well, he's having a great day. He's getting a lot of treats. But okay, so then the final one is really about self-care. And we actually have a handout about this that'll be with the resource list that's getting sent out. The great thing about protective factors, and one of the reasons that I think Strengthening Families has taken root in the ways that it has, is because it's not just about families we serve, it's about all families, and all people need these strengths and have them in varying degrees and need support with them at different times in their lives. So that is true for us as well as it is for the families we serve. So protective factors can be a helpful way to check in on our own well-being, make sure that we are taking care of ourselves, and excuse me, it can help us to think about self-care in a way that's a little more instrumental than just I'm going to take a bubble bath. Like, maybe you are going to take a bubble bath, but you're going to know it's because that helps you with your resilience, right? But it might be that you're able to think about self-care in some ways that are going to be more effective for taking care of yourself, so that you can continue to help and take care of others. And we really want to see human service providing agencies that encourage self-care, that promote it and encourage each other and check in on each other and check on each other's protective factors, because we're all in this work that can be really draining at times, whether we're dealing with families that are in crisis or even just day-to-day families that aren't in crisis, but just have needs and have support, need support, and was giving. And so we take time to take care of ourselves as well. So there are a bunch of tips for self-care related to each of the protective factors on this handout that we're sending around. And I encourage you to think about that. And if you're in a position to, have a staff meeting that you focus on self-care, you could use a tip sheet like that, or just start the conversation about how folks are feeling about their protective factors, especially as we come out of the pandemic, hopefully come out of the pandemic. We've all been affected by this in different ways. And so checking in on our protective factors can be a really important thing to do to keep ourselves healthy. So let's just stop for a little discussion. Are there any changes that you think you could make, or changes you have made that you want to share with others in your referral practices or how you plan events? And then also, how can you incorporate and encourage self-care? So let's start with the one about referral practices and event planning, the more like organizational pieces. Does anyone have ideas or things you've done or want to do that you want to share with others?
One of the programs I manage is only accessible to families that have been referred by a child protection worker. And when I reviewed the referral form after about 10 years of implementing the program, and really looked at, okay, what does the family see on this form? It was too system services oriented and less family oriented. So we revised it and minimized the amount of detail that needs to go on the referral, and included a place for the parent to sign the referral, and just made the language on the referral parent friendly. So it feels like they're getting information that makes sense to them about what the opportunity they're taking advantage of, and feel like not just my caseworker said I have to do this, but my caseworker offered this, and I think I want to give it a try.
Oh, that's great. I love that, Jackie, because I think so much of the time our systems are set up in a way that we are writing things down about families or saying things to each other about families that we would not say to the family themselves. And we can't do that because they're going to see it, or they're going to hear it, or it's just going to it's going to inform our own thinking about the families we serve. So we need to be careful about being strength-based, even in our internal conversation. I mean, sometimes you need to vent, and I get that, but like in our general conversations about, I'm referring you to this family because they need support in this area. That's a different conversation than I'm referring you to this family because this mom is a train wreck, right? Like, we wouldn't say that to the parent, so we shouldn't say it to another service provider. And what we put on those forms can be really, can color that conversation. Anyone else?
I'll hop in. So one of the things that I think has been really successful for us is when we're doing event planning. So we do a lot of collaboration. So, and if we know that if we're hoping to reach a certain audience, we're collaborating with some others that might be in a closer relationship than we might be around reaching that audience. So whether it's a food pantry or nutrition ed at the library, that bigger constellation and framework is just super helpful for us in kind of getting that invite out there broadly, and having the people that we are hoping will show up to show up.
Awesome. Thank you, Elizabeth. Sorry, I had to step away for a second. I'm back. I was listening. Anyone else want to jump in about, these are great examples of referrals and event planning. Anything else? Okay, so let's talk about self-care. Oh, Elizabeth, go ahead.
So, and one more thought on the event planning. Planning events with parents, right? So you're doing it as a team is really powerful.
Absolutely.
And a lot of fun. Yeah.
Right. More fun too, for sure.
Yeah.
Well, that's one thing that I want to endorse. I think having fun is a great way to encourage parents to participate. And maybe we take ourselves and this work a little too seriously sometimes. So let's put fun back into it, or let's make sure that we're including fun.
Thank you, Susan.
Susan, I have to say that when I think about, so I've helped to do community cafes and communities, multiple communities, and I always think of it like I'm planning a big party. And that's the framework. So I'm always thinking, how can I make sure everyone is feeling, welcomed and happy? But really from that perspective of like, we as a group are planning this event that's in part a party, right? And a celebration. Yeah, it is a kind of a great reference, really and it does make it more fun.
And Elizabeth, to piggyback off of that, I also think we can do that fun virtually. I attended the PNL last week, Thursday, Friday, with a few parents, and they had a DJ. They had we played all kinds of games, scavenger hunts. Like they made it feel like it was in person. So I think even being creative when we're using Zoom.
Absolutely, the power of a soundtrack. I mean, come on. Why haven't we been doing that? Yeah, and I think I met this a Head Start parent advocate from Hawaii who said that she had joined the Parent Advisory Council. All Head Start programs have a Parent Advisory Council, and she decided that was really boring, so she changed the name to Parent Party. They have their monthly meetings of the Parent Party, and they do fun stuff, and they do the business of the Parent Advisory Council. But she just was like, who wants to join a council? No, this is a party. We are here making this fun and having a good time. And I thought that was so great. She had an acronym and everything for what party stood for. But
oh, I'm sorry.
No,
I just wanted to, hi, Cynthia Shields from Parent Training Network. I wanted to hear if anybody else still had more ideas on how to make Zoom more creative with what we're talking about, because I heard the lady mention it and I was so glad to hear it. So I hope she can contact me at the end. I would love to talk to her more about it, because we normally conducted our classes at the libraries, and now the libraries, while they're reopening in New York, they are not making the room rentals accessible anymore, and they're trying to tweak out what they want to do with that. So we're on Zoom like everybody else, but I'm definitely with want to make it more interactive, more fun. I don't want it to be something where I'm just teaching something and they're listening. So I would love to get more feedback on that. And if the lady that spoke on it before, please feel free to contact me. I don't know if there's a way she can contact me, or can I send my number at this time?
Yeah, maybe if you're comfortable putting your phone number or email address in the chat, then Saisha will be able to see it. Am I saying your name correctly?
Yes, I'm actually sending her my information now.
Perfect.
Oh, thank you. Perfect. Thank you so much. And thanks, guys. I'm going to mute myself now so I can listen more.
Great. I'm going to prompt the question about self-care just to make sure that we hear a little bit about that. Does anyone have creative or structured or whatever ways of approaching self-care that you'd want to share?
Like whether it's for staff or like even in the scenario we talked about in our small groups, like sleep is so important to everybody's health, and how they approach problem solving, their own resilience, their own coping. Not getting enough sleep is going to impact all of that. Getting enough sleep is going to help you be able to face all these challenges better. I'm a big advocate of sleep.
Absolutely.
I'm going to share an idea that's been really helpful to me. It's so simple. And I give credit to Donna Morrison, who many of you know through Nicepep, working out of Westchester. But she did a program for us on self-care. And one of the takeaways for me was the 4 breaths. You go in and out, in and out, in and out, in and out. I do it whenever I'm feeling stressed, whenever I'm walking, whenever I can't sleep. Thank you, Margie. Whenever I'm driving and it gets stressful, it's just the deep breath in and deep breath out 4 times, and it's magic.
Great. Thank you.
I think
All
one
right.
thing we try to do in our programs is infuse opportunities, so little exercises into the regular agenda so that we can be practicing those things like the breaths or any other making stress balls with balloons and sand. But if you do it as a hands-on way and not just talk about it, then the families are more likely to actually try it again on their own.
Excellent.
Yeah, I think if you can kind of help define it, like for me, even I know, like I used to get kind of aggravated by the term self-care, especially during the beginning of the pandemic. I was like, I'm home trying to work full time with a 2-year-old and people are saying self-care. Like I do nothing by myself ever. Like there's no, like, so I had to unpack that, and I had a lot of it coming at me, which was great. But I feel like maybe sometimes if you're working with a parent and, you know, they're super stressed and hearing the, you know, so hearing that term can sometimes just be triggering for people. So I think just kind of defining it and giving easy examples like Susan and the breathing, or just like sleep is self-care, and nap is self-care, and you need it for your resilience. So that's something I think a lot about when I'm encouraging self-care, is to, like, I guess, know who I'm talking to about it and know that not everyone's like, fabulous idea. Like to me, it seems like it used to seem like this like bougie, like,
right.
Wouldn't that be nice thought. So.
Right. Yeah, it doesn't have to be going and paying for a service somewhere. It can be much quieter and cheaper than that, and done in the space when your child is asleep and you're still awake or something like that. So.
And Cailin, I think also can be done, you and your children together. I think in parenting ed, I remember a mom who told me, this was many years ago, 20 or more, I didn't know it was okay for me to play. So she was cleaning and doing dishes and cooking and all those kinds of things. And when she had this aha that she could just sit down with the kids and they could all play, that was relaxing for her, and it was good nurturing for the kids, and it helped manage some of their behavior that was trying to get her attention. So self-care isn't always you getting off by yourself doing some manicure or pedicure. Sometimes it's just, we talked about for the social things, it's having fun. And so finding ways to have fun with your family members can be good.
Great. Thanks, Judy. And I think Saisha wants to jump in.
I was just going to say, and I think, Judy, a part of that not knowing that we can have fun is raising our kids. We all kind of try to raise our kids the way our mom and dad did it, right? So if your mom and dad never played, like my mother would paint by number with us, but my dad, other than kickball, never played with us, right? So you kind of, and I know in my community, we try to parent like our parents did, but it's a new time, right, in the world. You can't parent the way your parents parent. There's some things we could take, right? But I think it's so different now. And I agree, playing with your kids, I have a 7, 8, and 17-year-old. We play all the time. I'm a mom and they respect me, but we have fun.
Yeah, that's awesome. Okay, I know we're getting to the end of our time. Oh, Kate, did you still want to jump in? I see you raised your hand.
Thank you. I just want to do 2 quick things. I really appreciate folks focusing on teaching self-care. I want to add one for all of us. particularly as we go through the pandemic, and now we're using Zoom and WebEx and meetings like that all the time. I have tried to incorporate into every meeting that I lead that we stop at least 5 minutes early, always. And I've heard of some people saying of kind of doing a 45-minute hour meeting, right? Just 45 minutes and then you stop. And I also, I'm thinking about starting a movement to, in your calendars, block off lunchtime, no meetings, because that time is getting used for meetings, right? Because you can't find time. And so there's your lunchtime gone. I think we should all just start blocking that off. Sorry, thanks.
Oh, thank you. I appreciate that. And I'm totally going to break that 5 minute before the end rule because we're right there and we still have some stuff to cover. So I'm going to keep us moving. I really appreciate everyone jumping in. I think we all have so much to learn from each other. So I'm going to quickly go through a few tools. I wanted to mention, because I know a lot of you are familiar with the standards of quality for family support and strengthening programs. There's no conflict between these two things. The protective factors are in the standards, but sometimes folks are not clear on sort of, am I supposed to use one or the other? And really you can use both. You might use one to structure your work and the other one is just in the back of your mind, and that's fine. But just to be clear that the standards provide guidance about sort of how to run a program overall. And strengthening families, when you look at our self-assessment, it's really small things that you can do. So it's kind of, they're at two different levels and can really, if you use both, maybe use one year and the other one the next year, it can really inform your practice in different ways. But just wanted to be clear because I know sometimes people are like, all these things are coming at me and I'm not sure how to make the connections between them. So I always think, take what you can use from each of them, do what you need to do for various funding requirements, but in your own thinking and your practice, you can use both. So just to be a real quick overview, we do have the self-assessment that I believe Sarah mentioned that family childcare programs and some center-based programs use. There's a version for home visiting. There's a version for community-based programs that works for a lot of parenting education and family resource programs. It's built around those everyday actions, as I mentioned. And so I just had some samples in here about what that actually looks like, how we go from big picture to protective factor to the everyday action and the specific items. When you complete that, you want to have a parent, a provider, and a director, maybe a larger team, but definitely those three categories, all completing the self-assessment. And then that and other information goes into an action plan. One of the resources that's going to be shared on the resource list afterwards is an action plan template that's very simple, but just helps you to kind of think of, here's what we want to do, here's who's going to be responsible and a budget and when we're going to do it, so that you can really get actionable, not just set goals that aren't very, very realistic. So with quality improvement, I just want to stress that you don't have to get better at everything at the same time, but the goal is just to improve. And so you can find actions that you could take that would expand on something, redesign something, do something totally new, reach out to new partners to reach a part of the population that's not being served well, whatever that might be. So I know we're coming up to the end of the time. I do not want to intrude on anyone's lunchtime. So we're going to wrap up. And after your lunch break, you'll be going into groups to talk more about applying all these ideas in your work. And I'll check back in with you then after those. So Tamaya, are you closing us out here?
Oops, sorry. I can, absolutely I can. So folks, we are going to take a break now until 1 o'clock. Let me get that up so that you have that. So we're going to be on a break till 1 o'clock. We will come back at 1 and we will head into breakout rooms and we'll be talking about the protective factors. Like, okay, so this is really important information and I'm all in, right? But I don't know what this means when I'm standing in the moment and this is happening, right? So we're gonna be working with some parenting educators and certified protective factors trainers to unpack all of this so that everybody is leaving with extra tools in their tool belt for your work tomorrow with families. And I will say, you know, sneak peek, that it's not just about your work with families. If you're going to be living the implementation and operationalization of protective factors work, it's really a 24/7 thing. And so you have not just the opportunity, but I think once you know all this information, it's like you can't put the toothpaste back in the toothpaste tube, right? So once you have all this information, you no longer just have the opportunity to engage in this work in this manner with families and everyone in your life, but you now have a responsibility. And so it's about us trying to figure out how we build muscle memory for that, so it takes less and less effort for us every day. So we're going to be spending some time talking about that when we come back at 1 o'clock. Cailin, thank you so much. We will see you a little later this afternoon. Wow, really fabulous stuff. So thank you so much for being with us today. I'm not sure if Kristen has anything else she wants to add, but if not, we are good to go for break.
Yeah, that sounds wonderful. Tamaya, thank you. When we come back at 1 o'clock, Tim Hathaway is going to provide a quick afternoon hello and welcome.
Perfect.
Enjoy. Bye-bye.
We'll see you then.